So when a patient comes in for their initial consultation, it's a chance to evaluate both the nature and the history of their pain complaint. It's beneficial to have medical records brought in if they've had any previous evaluations or imaging. If they haven't, then the patients are still evaluated in depth. We have a questionnaire the patients fill out that gives me a very good idea of how the pain started, the frequency, severity, what seems to bring it on, what seems to relieve it, a lot of aspects of the pain that are important to know in formulating an overall care plan. So in addition to reviewing medical records and any imaging that's available, as well as the patient's history, we do an in-depth but targeted physical exam in order to help determine what causes pain, which movements make the pain worse, if there's any restrictions in movement. It gives us a much better idea of what the source of the pain is and potential treatments for them. Once we've determined what the pain generator is most likely, then we'll formulate a treatment plan. Very often we need additional tests or imaging for the patient to have done, and we'll evaluate those. For example, additional X-rays, MRIs, ultrasound evaluations, perhaps neurodiagnostic studies. If they need those, then we'll order those initially and see the patient back to reevaluate. Once we have enough information to formulate a care plan, then we'll communicate that clearly to the patient so they understand what we plan to do, what our goals of treatment are, how long we anticipate the treatment going on for, and what the expected results are.